Brazil has become the second country after the US to pass 400,000 deaths from COVID-19, and experts warn the daily toll could remain high for several months. Here's Pedro Hallal, who's an epidemiologist at the Federal University of Pelotas. Pedro, thank you so much for being with us. So, a grim situation. What's your reaction to this number, 400,000 deaths being reached?
I think the word is frustration, because we know that 3 out of 4 of these deaths could have been prevented if Brazil was performing as the global average in terms of responding to the pandemic. Obviously, I'm not even saying to be responding as good as Australia, but if we were on the average, we would have saved 300,000 lives. And it's very frustrating for a scientist to see that scientific recommendations are constantly ignored here in Brazil.
Pedro, I understand you've recently had some sad news regarding somebody you know.
Yeah, every Brazilian has sad stories to tell. This week I lost 2 friends. 2 hours ago I lost one of them, and this is happening pretty much every day. And the funny thing about Brazil, and obviously not funny, but the strange thing about Brazil is that people are getting used to it. So in the first wave, at some point we reached 1,000 deaths a day, and we started reopening. And obviously we kept at 1,000 deaths a day for several weeks. And now in the second wave, we reached 2,000 deaths a day, and we are there again, and we will stabilize at that level because we are not doing the restrictions that science would recommend. So this is very frustrating for a scientist.
And is that number likely to increase still further? When is the peak expected, Pedro?
So I think that the peak has passed, at least in this second wave. Right. And at least part of it is explained by the new variant, the P1 variant, that is widely circulating in Brazil. The problem is that if we do not speed up the vaccination, it's possible we will have a third wave, and maybe that third wave will have even higher numbers than we have now. So realistically, when I was watching the show, I was a little bit jealous of you in Australia, because, we have ever been jealous of you in terms of your swimmers, not your football players, obviously, but now we are absolutely jealous of your COVID response that has been spectacular as compared to ours.
Yes, it is a desperate situation where you are. Where are things with the vaccination rollout and that program?
So our goal is to have 1.5 million doses administered per day. So our average in the first months of the campaign were just 300,000 a day, so 5 times less than it should. Over the past 2 weeks, the situation got a little bit better. We are vaccinating around 800,000 people a day. So we still need to improve a little bit, but at least we are in the right direction. So around 15% of the Brazilian population got at least 1 shot, and the numbers are getting better. So I think in terms of the vaccination, we are getting better. Our main problem is social isolation and lockdowns, and we pretty much never do that.
Well, as you say, from the start of the pandemic, Brazil's president has appeared to be very cavalier about lockdowns, masks, etc. Is he showing any sign of changing his opinion towards those things?
Not at all. Sometimes he's getting even worse, because when the vaccine arrived, he said he would not take it, and if you would take it, you would be on your own risk, and if you would become an alligator, it would be your fault. So, these quotes come from the president of the country, and obviously then you can understand why I said that 3 out of every 4 deaths in Brazil could have been averted if we were not doing these anti-scientific actions to the pandemic.
So are people taking it upon themselves then, Pedro, to socially distance and wear masks in the absence of direction from the government?
Yeah, some people are, but some others are not, because they voted for this president and they trust him. And when the leader says, this is not important, people will trust him. And this is why, there is now an open investigation to see what's going on. And realistically, we know that the president himself will be blamed for all these deaths.
And how's the health service and the hospitals coping with these numbers?
You know, 3 weeks ago, pretty much every state in the country had an waiting list for ICU beds. Look what I just said. A waiting list for ICU beds. So people were in need of an ICU bed and they could not get one because they were full. The situation got a little bit better over the last 3 weeks. But in my state, for example, you still have a waiting list for ICU beds. So it's not 100%, it's over 100% because of the waiting list. So that's the situation in my state. In some states of the country, the situation is a little bit better. By better, I mean 90% occupancy, but it's still very high. And we need, the only way to make it better is to stop the virus from spreading.
And just finally, Pedro, what are oxygen supplies like?
In most places, they are fine at this stage. We had the situation in the Amazon region some months ago. It got better. In my state, in the extreme south of the country now, we had problems some weeks ago, but it's now better. So I think that the oxygen supplies will cope with this second wave. I just want to avoid the third one, because that one would be more problematic, because probably it would be even higher numbers than we are observing right now.
Okay, Pedro Hallal, we wish you all the best. Thank you so much.
Thank you very much. It's my pleasure.